thank you so much for the opportunity to speak with you this morning. It's been a pleasure to hear about all of your work, and it's really nice to see the synergies in the work that's been presented thus far. I think one of the things that we have in common is that we're all focused on serious quality gaps in our respective areas. Another thing that we have in common is that many of us are focusing on implementation in very complex systems where we face multi-level barriers to change. And obviously a focus of implementation science in these related fields is to identify, develop, and test implementation and quality improvement strategies. I think we've made a lot of progress in that area as a field. We've identified a number of potential strategies, and the evidence is really emerging for their effectiveness. But there are a lot of challenges to applying implementation strategies in real-world settings in a way that is thoughtful and responsive to context. Number one, the evidence for these strategies is imperfect at this point. Number two, there's a lot of contextual variation. This has been emphasized throughout the morning, and the barriers to change are constantly shifting with time. There are also a number of strategies to choose from, so it can be sort of bewildering when you consider just the sheer number of strategies to choose from and how to sort of thoughtfully combine them to address real-world problems. This has led to what Martin Eccles has called the Islagyat problem, in that we often select implementation strategies because it seemed like a good idea at the time. And this is another way of saying, basically, this is an expensive version of trial and error. We're often sort of repeating the same mistakes and maybe repeating trials that don't need to be repeated. Another challenge that we have is often assuming that a one-size-fits-all approach will work for implementation, that strategies don't need to be tailored to specific contexts. And I'm arguing today that we should be more thoughtfully applying implementation strategies based upon a thorough knowledge of the context, and that includes real engagement with stakeholders in the context in which we're working. Great to hear Allison's work on co-creation and really emphasizing that point, as well as many of the others who have emphasized partnership approaches. We also hope that implementation strategies would be selected and applied based upon relevant theory and conceptual models that suggest they may be effective. And of course, hopefully we have some evidence to suggest that specific strategies will be effective. There's actually an increasing movement to develop and test tailored strategies to implement effective interventions. And this is actually the second version of a Cochrane review that demonstrates that tailoring interventions for implementation can be effective, but there's also a lot of variability in those trials. And one of the calls from this Cochrane review is that we really need to develop the methods for tailoring implementation strategies. And that includes really methods to identify and prioritize barriers, and methods to more systematically link barriers to specific implementation strategies. A challenge in this realm, just an example of it, is highlighted by Bosch et al., who suggests that there's often a mismatch between the barriers that we identify and the strategies that we use to address them. So for instance, we might identify organizational barriers, but rather than addressing those core organizational processes, we might respond by providing more provider education that's really focused on individual provider change. So my colleagues and I have been focusing a lot on trying to develop more systematic approaches to select and tailor implementation strategies. Some of that has involved identifying specific methods, and so the top paper there is a paper that identifies intervention mapping, concept mapping, group model building, and conjoint analysis as potential methods that could be used to link strategies and barriers. I've also been involved in efforts to test tailored implementation strategies in an NIMH R01, focusing on measurement-based care in community settings. I'm really excited about some work upcoming that we just got funded for to develop something that we're calling the collaborative organizational approach to selecting and tailoring implementation strategies. And this is going to be working with colleagues from the Center for Child and Family Health in Durham and the National Child Traumatic Stress Network to hopefully improve their approach to implementing trauma-focused cognitive behavioral therapy for children and youth. And this organizational approach is going to be developed, hopefully co-created with the stakeholders from those organizations. in year one, and then tested in a randomized pilot trial with 8 organizations. And the idea is that we're going to be working with them to use a systematic approach called intervention mapping to really carefully select and tailor implementation strategies that are contextually appropriate for them. So thank you so much for your time, and excited to engage with you. And if anyone is interested in this area, I'd be glad to connect.